Today, I want to come to you, Dr. Shah, because our story highlighted Ahmedabad and the crisis there. Now, this is, of course, the Prime Minister's home state, the Home Minister's home state, and it appears that even the Gujarat model that we've spoken about is cracking. Ahmedabad was being built up as a health city. Why is the health city of Ahmedabad facing such a crisis? What explains the collapse of the health infra system, and what is it that is being done at the moment to resolve it, sir?
Yeah, I totally agree. The system is getting collapsed. And the reason behind this is this second wave has been more deadly as compared to the first wave. And during the first wave, we were more prepared, better prepared. The government was very well prepared. And there was a lockdown which had given us a time period where we were able to prepare a lot of things. This time, somehow everybody did not anticipated this COVID breakdown, second wave, and nobody had anticipated that this will be too deadly. Unfortunately, it is because of this mutant virus, which is more deadlier than the first virus. The spread is like a wildfire or bushfire spread, and it is spreading like this. So obviously, at this point of time,
the system is... Sir, if I may ask, then what happened in the last several months in terms of augmenting infrastructure? We thought that the lockdown in the first wave was going to be used to augment health infrastructure, so we were better prepared. Everywhere across the world, people knew there would be a second wave. Did we let our guards down? Did the hospital and the governments let their guards down and celebrate prematurely, Dr. Shah?
I totally, partially and totally agree to that. Because of a slowdown in the month of Feb and part of the March, people thought that we have won the fight against the COVID, but actually we did not, and we were supposed to anticipate this second wave, and we should have been prepared for that. And even there were some, I would say, statements from a lot of bureaucrats saying that we have won this fight against the COVID, and this COVID is now gone out of this country. And unfortunately, second important thing was we could not step up the vaccination program, which we were the front runners in production of the vaccines, and we could not step up. By the end of 2-3 months, we should have been able to at least vaccinate the youth and the people below the 50-60 who are roaming around across the city, across the country. And they are the mainly spreaders, not the people who are sitting in the house who are more than 60 years, 70 years. They are not the spreaders. It is the young generation which is the more spreader of this disease. So I think so. It is. So
you're accepting in a. You're being very honest today. You're being extremely honest in saying we just were not prepared. We let our